Hi, my name is Katie McMurray, and I'm one of the clinical pharmacists with the Michigan Medicine Kidney Transplant Program. Today during this video, we will review important medications that you will take after your kidney transplantation. In addition to this video, you will receive education after your kidney transplant surgery before leaving the hospital. Today we will review what is rejection, what prevents rejection, what are the new medications that you will take to protect your new kidney after transplant, how will you take your new medications, and what are side effects of your new medications. So what is rejection? Your body's defense system, called the immune system, is made up of antibodies, which are proteins, and immune cells. They fight off things that are foreign to your body like bacteria and viruses. Your immune system keeps you from getting sick. Unfortunately, your immune system may also think that your new kidney is a foreign invader and try to attack it. We call this rejection. The kidney transplant team will prescribe medications that block your immune system and keep it from attacking or hurting your new kidney and causing rejection. We call these medications immunosuppression or anti-rejection medications. These drugs weaken your immune system, but they do not eliminate it. Your body will never fully recognize the new kidney as your own. Therefore, anti-rejection medications will be required for the life of your kidney transplant. It is very important to take your medications as prescribed. The success of your transplanted kidney is dependent on the proper use of these anti-rejection medications. The right amount of immunosuppression is a constant balancing act. Not enough immunosuppression can result in the rejection of your new kidney. Too much can cause infections or side effects. Your transplant team will work with you to find the best medicines and balance to keep you and your transplanted kidney healthy. It is very important to take your medicines as prescribed. In general, you will take two kinds of medications after your transplant. The first, medications to keep your body from attacking or rejecting your new kidney. This includes 3 medications that you will take for the life of your transplant. The second, medications that protect you from infection. These include 2 to 3 medications that you will take for a short time after your transplant. Tacrolimus extended release, or commonly called Envarsus, is the first medication that helps to prevent your body from rejecting your new kidney. You will take Envarsus once daily in the morning. It is important to take it consistently in relation to meals. Your dose of Envarsus is determined by blood draws. When you go for a blood test, do not take Envarsus in the morning before the test. Get your blood drawn first and take your Envarsus after your blood draw. We call this your trough level. It is important to have your trough level measured at the right time. Ask your transplant team if you are confused about when you need to have a sample of your blood taken to measure your trough level. Some side effects that you may experience while taking Envarsus include tremors or shakiness in your hands. You may notice it more right after transplant. Call your doctor if the shakiness becomes bothersome or uncontrollable. You may experience headaches. Let your transplant team know if they are not relieved by acetaminophen or Tylenol. When your trough level gets too high for too long, Envarsus can cause damage to the kidney. It will be important to get labs as scheduled to monitor your Envarsus trough level so the team can prevent any injury to your new kidney. There are many other medications, food, and supplements that alter the Envarsus levels up or down in the blood, and you need to be aware of it. The list is long, and you shouldn't worry about memorizing all of them. Instead, keep in mind the general rule. If you start any new medications prescribed by other doctors or buy anything over the counter, ask your transplant team first if it's safe for you to take. You should not take ibuprofen, Motrin, or naproxen Aleve because they can cause damage to your new kidney. You will want to avoid the following fruits: grapefruit, pomegranate, papaya, pomelo, and starfruit. Avoid eating them or drinking the juices either by themselves or in sodas or mixed juices. To summarize important points about Envarsus, you will take Envarsus once daily in the morning. Take your Envarsus after you get your blood drawn. Avoid certain fruits and ibuprofen and naproxen, and ask your transplant team before starting any new medications to ensure that it's safe for you to take. Mycophenolate is the second medicine that helps to prevent your body from rejecting your new kidney. It's commonly called by its brand name Cellcept or Myfortic. You will take mycophenolate 2 times a day, 12 hours apart, once in the morning and once at night. A common side effect of mycophenolate is diarrhea and upset stomach. Contact your transplant team if diarrhea, nausea, or vomiting becomes bothersome. It can also lower your immune cells in your body. The transplant team monitors this on your blood draw and will let you know if any medication changes are needed. Do not make any changes to your medications, including how or when you take it, without first talking to your transplant team. Prednisone, also known as your steroid, is the third medication that helps to prevent your body from rejecting your new kidney. You will take prednisone only once a day in the morning. Right after transplant, you will be given high doses of steroids. Your dose of prednisone will decrease over time. This is called tapering. By 30 days post-transplant, you will be on the lowest dose of prednisone at 10 milligrams. You will continue on this dose until told otherwise by your transplant team. At the time you leave the hospital, you will have a taper schedule with dates that will tell you exactly what days to decrease your prednisone. There are several side effects as a result of taking prednisone. Some of them may improve as the dose of prednisone lowers over time. It is important to note that you may require other medications and extra labs to address the side effects of prednisone after transplant. The team will work very closely with you if that were to occur. Let's review important points about your new medications after transplant. You will be started on 3 new anti-rejection medicines after transplant. It will be very important that you take them as prescribed. You will take them for the rest of your life, and they include tacrolimus, mycophenolate, and prednisone. You will also take 2 to 3 new medications to prevent infection for a short time. Never stop taking any medications unless instructed by the transplant team. You will receive more education from the pharmacy team and nursing after transplant. Where can you find more information in the meantime? Refer to your Michigan Medicine transplant book or ask your transplant team.